So I think, sir, Dr. Nirpender and Dr. Dhruv, we will start this.
Yes.
And for all those you have joined here, hello and very warm welcome to the third episode of Expert Exchange 2.0, our exclusive webinar series designed to inspire, educate, and connect mind across the scientific community. Good afternoon to all joining from India, and good morning to all our global audience tuning in from the world. I am Anand Goswami, DGM Marketing from Acumex, and I'm honored to be your moderator for today's session. At Acumex, we are proud to be more than just a product provider. Headquartered in Ahmedabad, India, with world-class manufacturing facilities across India and Germany, we have been the forefront of laboratory innovation since 2003. But beyond the products, our vision is to be your partners in progress, committed to sharing knowledge and empowering the next generation of researchers, innovators, and problem solvers. That's what Expert Exchange 2.0 is all about, a platform where science meets dialogue and expertise is exchanged to drive the industry forward. Today, we are privileged to have with us two distinguished thought leaders from the field, Dr. Dhruv Mamtora and Dr. Nirpender Singh, who will be sharing their insights, experiences, and practical wisdom that can support and inspire researchers at every level on today's topic. Every drop counts, the science and significance of low retention tips. Our first panelist, Dr. Nipender, who is scientist at the Mass Spectroscopy Facility, Institute for Stem Cells Science and Regenerative Medicine, Bangalore, with expertise in proteomics and analytical biochemistry. His work has greatly contributed to understanding infectious disease and molecular interaction, especially in bacterial pathogenesis and host virus dynamics. As the head of the facility, Dr. Singh is instrumental in advancing high precision analytical tools and methodologies that empower biomedical research. His leadership in managing the core facility has optimized workflows, encouraged interdisciplinary collaboration, and ensured that state of the art spectroscopy resources are available at support innovative discoveries in the life sciences. Sir, it's truly a pleasure to have you on our panel today.
Thank you.
Our second panelist is Dr. Dhruv Mamtura, who is Head of Lab and HIC, Quality and Accreditation Coordinator for Wadia Hospitals, Mumbai, with a proven track record in advancing scientific understanding through innovative research and data-driven insights. With his 200 citations in the field of microbiology, immunology, molecular biology, infectious diseases, and infection control, his contribution reflects both academic excellence and real world impact. Dr. Mamtora's work spans across critical areas of life sciences, where he focuses on translating complex scientific concepts into meaningful outcomes that drives progress in research and application. Known for his analytical rigor and collaborative approach, he continues to contribute significantly to the scientific community through publications, mentorship, and thought leadership. Sir, we are delighted to have you with us today.
Thank you.
So, all the participants who have joined us for this webinar, thank you for being here. If you have any questions during the session, feel free to drop them in the chat box. We will address them one by one after the panel discussion gets concluded. Now it's time to begin our panel discussion, a session packed with thoughtful questions designed to tap into valuable insights and experience of our esteemed panelists. So my first question will be to Dr. Nipendra. Sir, in high precision experiments, even micro level sample loss can affect results. From your experience, how significant is sample retention within the pipette tips? And when does it start becoming a real problem in the lab?
Okay, so this is actually a very important question which you have asked. What happened is now these days the era of having a big size reactions in a lab is gone. So what we are trying, or everybody, all of the researchers are doing is they're putting a reaction in a microliter volume, and hardly anybody is there in the lab who will put a reaction in a ml and something like that. So all of this is, since we have miniaturized the reaction, so all of this reactions which we are putting into microliters, even 1 microliter, 2 microliter, become a sample for 1 microliter, 2 microliter, and putting a reaction for 20 microliter. If you suppose has a loss of 0.5 microliter in any of this reactant, then ultimately that ends up having a altogether different reaction kinetics, and that ultimately gives you an unpredictable result or sometimes non-reproducibility in the sample. So that's actually a very, very important aspect to understand. And I think this webinar is one of the key things to discuss now these days. Yeah.
Yeah, true that, sir. Dr. Dhruv, what are your thoughts on this? What is your experience in terms of significance in sample retention within the pipette tips? And when does it start becoming
So
a real?
I think nowadays, we are doing everything in microliter volumes. So I think in molecular biology, whenever, like often the volumes which are less than 10 microliters, I think then, reproducibility becomes important in your diagnosis when especially low volume accuracy are very important, and that's why that retention is going to be on your checklist if you are a thorough quality assurance person. So you can mitigate it by multiple things, like you can use low retention tips, you can pre-wet the tips, or you can blow out the pipette, to release that volume, or you can do reverse pipetting. And sometimes we teach our staff about the angles and the immersion techniques whenever they come new to the molecular lab, I think. So these are some of the techniques we use for the, I think, for the overcoming the issues.
Very true. And that's very crucial point which you've highlighted, sir. Yeah, so I would like to move on to the next question, which is around reproducibility. It's one of the very crucial aspects. So, as we know, it remains a major concern across the research fields. How much do consumable like tips influence data variability? And do you think this aspect is underestimated, Dr. Dhruv, to you?
I think, see, this is like never going to be documented, okay? And it's an unrecognized threat to your quality. I think so. I mean, see, consumables include your reagent, include your plasticwares, which also includes your tips, and also, everything, whatever we are adding on, are adding to the variability. That delta is variation. So it is all getting counted when you are considering your quality. So that's why, if you are not carefully choosing those, they are adding the cost of quality to your lab. And if you don't do thorough standardization experiments, probably you are not going to achieve that level of precision, accuracy, even then the reproducibility which you desire, especially in the field of molecular biology. Because here what the problem happens, like in between, you don't have any quality assurance step. I mean, whenever your results come, that is the last stage when you will come to know, like, whether your experiment has become successful or your experiment has failed. The same, I think, applies to the flow cytometry also, where we have this costly fluorophores, and there also the pipetting is very essential. Or for that matter, simple ELISA techniques, etc. It's very important. So I think reproducibility, when you are counting, I think everything should come into the picture, and we should try to go to the depth of each and every step.
Right. So, Dr. Singh, with reference to your workflow into the mass spectroscopy, how do you that the consumables like micropipette tips contribute to the reproducibility? How important is that? And what are the aspects which are often underestimated in that case?
Okay, so in mass spec, what happens normally is, especially in that these days mass spec, most of the reactions which we put it for, even for analytical, all of the analytic techniques, whether it's a quantitation or identification or characterization of any biomolecules, all of these reactions normally a very, very low amount. So that means our starting point is somewhere in a nanogram range or maybe in a picogram range. And so what happens is if any of your reactant is not getting dispensed properly into your reaction mixture, so ultimately that leads to a tweak ratio into your reaction component, and that ultimately end up having a not having a proper product. And then you always find out that okay, in one time my reaction product has generated some different product, not some completely different, but this product quality was not that great, and next time it is something different. So this create a lot of problem for the quantitation, which is the backbone of any of the analytical techniques. As Dr. Dhruv mentioned very clearly, you mentioned any of the analytical technique, whether it's a fax, whether it's a ELISA, whether it's a Sanger sequencing, whether it's a NGS, all of these places, all of these analytical techniques needs a very, very high precision dispensing. And for high precision dispensing, it's very important what you pick up, you should dispense. It should not happen that you pick up 1 microliter or 1 microgram or 1 picogram and you dispense only 900 nanogram. So, and who will cover the loss of 100 nanogram? And because your reaction which you thought about always works in a molar ratio. And if you change the molar ratio, all of these kinetics will go haywire. And then you will always, lab to lab variation will always be happen, and the protocol which you are following might have been done on some kind of particular concentrations, and then that concentration goes change. And then ultimately that results into a different, altogether different scenario, and which you predict as a different outcome, which is actually not a different outcome, which might be a different handling process. So we need to be very, very careful about how we take the samples, how we process the samples. Very important aspect.
Yeah, the very critical point, sir, which you mentioned. Another question, which is in the same correlation to you, Dr. Singh. When we talk about the mass spec workflows, we know like every microliter matters, right? So, what role do pipetting accuracy and retention properties, to be precise, play in ensuring consistent quantification and reproducibility?
Okay, so as I mentioned previously, we always put a reaction in a very small amount, and if we suppose we need to always add a trypsin or any kind of reagent into a 1:100 ratio, and the all amount is always less than 1 microgram, 1 microliter, and putting a one less than 1 microliter or 1 microliter, and this all these reactions are always in such a way that we don't cross the limit of 1 microgram into a mass spec. So if we have to put all the reaction content into such a manner that we get a reproducible reaction, our pipetting need to be very, very good. Our whatsoever, as I mentioned, whatsoever you pick up, you need to dispense it. You cannot hold anything with you because the amount which you are indented to dispense is very, very less. So this is very important for any other, even that's most of the the example what I gave is one for proteomics, but even for a metabolomics also, what we do is we always pick up internal standards, which mostly those internal standards are labeled reagents, labeled metabolites, or labeled carbon chains. And if we pick up a wrong amount of level carbon atoms, so that will ultimately leads to a different normalization ratio, and which ultimately generates a different quantitation result, which is not very good. So that's the reason whenever any students come to the lab, our first thing is we always say, do you know how you can pipe it? And can you do a triplicate pipette and then show me if everything is fine? So that's the precise thing we do for our students.
Yeah. True, sir. True. Very, very insightful experiences which you shared. Dr. Dhruv, my next question is to you, which talks more about in your experience, you would have seen the most common mistakes the researchers make when they handle the liquids while transferring, and how can awareness about micropipette tip properties help them improve their experimental accuracy?
Okay, so I think as Sir mentioned that whenever the researchers come, we tell them that how they are doing the pipetting. I think is the first part of the training. So, like so they are there for the learning. So they have to understand first the pipetting techniques. How to deliver the exact quantity of the material from one, like whether you are taking substrate or whether you are taking the extracted DNA or RNA. that is very important because see, uh, your pipetting technique will determine your accuracy, reliability, and reproducibility of your results. I think so. That is the first step. Even the quantity of your DNA or RNA extracted probably the quality of that sample all depends on your pipetting techniques. And secondly, like avoiding the carryovers which can happen during the molecular experiment because we have seen the COVID, when hundreds of samples are coming together and we have seen a lot of false false negatives and all this happen. So I think the pipetting techniques are very essential. I think you do, I mean, it is about doing all the time, not just like you forget to brush your teeth in the morning. So like you have to use the same pipetting technique which you are using on the first day also, the second day also, third also, and continuously probably. And I think this is going to make uh, impact. Of course, mistakes happen with the young research, but uh, I think then we have to decide like who is making the least mistake. I think is the most efficient person probably. That way we can understand the scenario.
True, true. I think well said that. Dr. Sai, next question is to you, which talk. I mean, say for an example, if two researchers perform the same experiment using different pipette tips, can that actually lead to different results? How significant is the role of pipette tips in maintaining experimental consistency?
So I can tell you an example. What happened is when PhD way back in 2004. So that time my she always was very peculiar about because that day I was doing a vacuum development for leishmania. So there was a lot of antigen available in the lab. So any new student used to come in the lab and their first job was to only perform ELISA for next 2 months. Nothing else. You don't have any other job. You come to the lab in the morning, put the plate, and do the ELISA. And I easily, right now also I remember, she has a record for all the students who has graduated from the lab from last 20 years. And whenever you do ELISA, she always say, oh, go check your result with X student, how that person has performed and how your performance is. And she has a gold standard always. And she always say, go and check how this has that guy has performed and how you are performing and how much variation is there. So and you won't get any other work in the lab till the time you get up to a certain percent error of that thing. And if I now I go to your second question is how this tip involves this thing. So previously the tips, whatsoever tips we are using, most of the tips doesn't have this loading capacity or the most of the things are just getting stick to the tip. And then some of the you always lose. And if you are, especially if you are dispensing a different concentration into a tube, then problems start occurring because if you injecting if you are putting concentration into a tube, then loss is happening into each tube is the same, almost same. If you are dispensing 1 picogram to 1 microgram and to 1 nanogram, then the amount of your protein, RNA, DNA, or whatsoever biomaterial is there, some amount definitely get stick to the tube, and that will won't get transferred into the or the reaction mixture. So there you always see a difference. So it's very important. You should always say in a facility we always use the tube and tips which doesn't have a very high binding capacity. Because if things will bind on the tube and the tips, then our whole of the goal of having a nanogram level sequencing or the picogram sensitivity is this claim doesn't work. So we always has to be very careful about what tips we are using. So whenever we are doing a selection of the tips, we always be very careful what tips or what tips we are using, and it is always a tube which doesn't adhere to this biological materials.
Yeah.
So
I
that's the
mean,
thing.
yeah, yeah. I mean, you shared the entire journey which you have seen, your experience. That's very true in the real case scenario. Dr. Dhruv, when say like our today's topic also talks about drop count, right? We are trying to emphasize on that precision and accuracy. what does truly that mean for a lab, especially into the diagnostics or clinical setup which you are into in day-to-day lab work?
See, I think one is the quality assurance is very important part, and the consistency with which you can give the accurate results and within the stipulated time. I think these two, three things are very essential when you are counting the productivity of any molecular lab or probably for that matter the sequencing lab. So uh, I think the volume does matter, even your precision matters, and reproducibility will depend on the consistency of staff, how accurately they can deliver the exact amount of it's all about the flu. You are dealing with all wet lab for the this thing, your sequencing result depend upon your wet lab, how thoroughly you have done the wet lab experiment. Your molecular biology PCR result depend on how thoroughly you have done the extraction and template addition and master mix and all these things. So probably, I think the smallest mistake can have a bigger consequences in form of repeating the experiment, or redoing the whole thing from the beginning. So um, I think if you are consistently doing the things right and your data is good enough, then only your results are going to be kind of respected, and then you will be known for your consistency. I think so. That's why that every drop counts. I think is very important in this scenario.
That's true. That's true. That's true. What are your views, Dr. Singh, on this when we talk about your portfolio, your workflow, in fact, into mass specs?
Yeah, so I completely agree with that, Dhruv, what he has mentioned, because every lab has a standard set of standards, and like I also run a lab which caters to the need of so many researchers, and our methods are followed by so many people. So if we are not true enough to what we are claiming for any method development, then our method won't be validated across. And we always works on validated methods. And if these validated methods always needs a very high precision of pipetting, and the tips play a very important role. So if these methods are not validated, and how this validation will only come when you have a confidence about how much you pick up and how much you dispense. And if this is not there, then your method validation is not going, and then ultimately your reputation, your lab reputation very bad. And then ultimately whatsoever you do, nobody will believe it, and then this will be challenged the lab. And then that's the precise reason we always believe that whatsoever you do, you should always have a consistency and reproducibility. And this, as you mentioned very clearly, this every drop counts. And definitely, suppose we are putting a 3 microliter sample into a sample vial, it has to be 3 microliter. It cannot be 2.5 microliter. It cannot be 2.8 microliter, because then my calibration graph is not going to be what it intended to be, and then my R square is never going to be 0.999. So then how I'm going to quantitate it? So very, very important for any of this method, which is going to be for any diagnostic setup, or going for any research questions. So I think it's very, very important.
Yeah, yeah, true. True that. Dr. Dhruv, my next question is to you. Can using standard tips versus low retention tips lead to measurable differences in experimental reproducibility or data accuracy? Obviously, yeah, we know molecular and some precision experiment that need to use low retention tips, right? But then about how about the routine experiments? Does that make a difference?
I think as I earlier mentioned, the quality variability can have multiple factors. Pipetting things are one of the hidden variable probabilities. We are not neither we are documenting nor we are kind of documenting or discussing most of the time. So what may be that like you may have unexplained variability of your experiment when you are doing the reproducibility as or you may have inconsistent yields of, the quantity of DNA or RNA which you are isolating from the clinical sample, or there may be drift of the values or sudden shift of the value. It may be one of the hidden variables. And probably when you are doing ultra-sensitive assays, like the molecular or the sequencing assay, and all this is important. And low retention can have kind of a measurable, and sometimes it may even have significant differences in experimental reproducibility and data accuracy, because it helps especially for the low volume, like we discussed, that less than 10 microliter kind of workflows. Um, and even as Dr. Singh mentioned about the mass spectrometry, where they are counting everything in nanogram and picogram, probably for low volume kind of assays, for very sensitive assays, and for the quantitative assays, where the quantities are very important, probably it will help in the data reliability. It will reduce the inter and intra assay variations, and also it can give you better reproducibility, so you are confident while reporting those values. I think that way probably it will help.
True. Yeah, yeah, that's true. So, sir, Dr. Singh, of this continuing the same question, maybe in a different, adding up to it, as like, do you think with your experience, are there certain liquids or reagents where low retention tips make a bigger difference?
Yes, especially the organic solvents and the high concentration of any of the biological materials plays a very important role. And what happens is in very low concentration losses, it's okay. At least you can somehow manage it. But as soon as you start using these organic solvents, these tips are like for glycerol, diamoso, maybe isopropanol. You have to pick up any of these solvents, and normal tips normally fails. So then you have a tips which can hold these solvents, and then up to in a mass spec field, you need to use all of these solvents. So if your tips is not serving these solvents, then you are in a big trouble. So we always consider that any tips which we are using, first of all, this should be compatible with this kind of organic solvent. Second, it can handle the viscous solvent. So that's a very important. Then what happens is you have to use a very high concentration of protein, but in a very low amount. You might use the 2 microgram of protein, but the 2 microgram of protein need to be there in a 0.5 microliter. So that definition what you are talking about is 4 mg per ml, but the amount is 2 microliter only. So that there, if you have used a tip without low retention, it will have a lot of loss, and that will reflect into your results. So that's a challenge we all the facilities or all the core labs face.
Okay. Dr. Dhruv, considering like you just mentioned, like, sometimes in a hospital setup, you get a lot of samples, right? I remember the COVID time when your hospital was more into the and the other molecular testing, also the sequencing part. So, I mean, a question to you in that scenario, can switching a low retention tips makes repetitive task quicker or more reliable in a busy lab setting when you have more samples?
I think, yes, I think it will definitely make the repetitive tasks more quicker and reliable. As I said, that the inter and the intra-assay variations are reduced, and especially when we have to follow the tight schedules with the turnaround time, which are very less, because they expect the patients are sick, they expect results within 4 hours for all the PCR assays. And the staff is juggling for multiple tasks, because we have at a time 5 assays running in my molecular lab. So I think in those areas where you have a high throughput lab, probably it will make some impact, and especially our staff when they are doing multitasking, especially dealing with the low volume. I think that time it will help.
Okay. Right. That's true. Sir, Dhruv, I think if you can be a little bit louder, I got a comment from a participant that they are not able to hear it properly. I will have another question to you, Dr. Dhruv, in precisely the clinical setup like Wadia Hospital. How critical is sample integrity and volume consistency when working with pediatric samples or low volume specimens?
Okay. So I think it is all about, as we told, the reproducibility of the assay, the accuracy, the precision which you desire. I think it is very important that the sample integrity is there. So like proper cold chain maintenance is very important. The volume, because at times they have the core, middle core biopsies you get, which are very small portion of that, and they want to do some kind of virus studies on those core biopsies and all. So I think this one is the part of your quality standards which you set for your organization. It's very essential, especially the pediatric setting. Where you to get second sample is going to be very difficult at times when you have a sample like CSF examination of the small biopsy or the middle core biopsies, and you are expected, you are compelled to do the right diagnosis with the whatever sample is available, especially the newborn, early, like very early low birth weight newborns which are born, and when we have to do some studies on those, especially like congenital CMV infection and all those probably. So there I think it matters a lot. So I think it's a very crucial that sample integrity is very important, especially the sample volume is also very important.
True that.
Could you hear this one?
Dr. Singh, coming to you, uh, this labs often look at consumables recurring cost, right? For any lab, be it a research lab or diagnostics or healthcare, any kind of lab, will obviously talk about the recurring cost of the consumables, right? Do you
Mhm.
think investing in higher quality, low retention tips ultimately saves resources in terms of reduced repeated experiments and reagent wastage? What are your thoughts on this, Dr. Singh?
Yeah, so actually, the same example what I gave in a beginning, when I joined my PhD in 2004, I need to repeat a single experiments for 2 months to get a reproducibility. And at that time of point, I think there's an unavailability of low retention tips in that country, and we were using a very universal tips which is coming to the lab. And being a fresh PhD, we were never got a chance to get a low retention tip if it is available in the market. So even that was a I was doing a PhD in National Important Institute of National Importance, but still getting a low retention tube in 2004 is a very difficult challenge. But what I wanted to convey here is I repeated the experiments, suppose if I remember it correctly, at least 60 times. So the same story, if somebody else has to do the same experiments 5 times in a lab and then get a reproducibility, rather than if it is a trained person and can finish the experiment in 2 times, so it's still a cost saving. And not only the cost saving, the confidence of the staff always goes down if number of experiments iteration that person has to do again and again, and that person won't understand what is the problem here, because it is not always true that person is doing this mistakenly or by some mistake. It is all sometimes it happens that we are not using a proper gear, we are not using a proper tips, and we are not using a proper consumables. So it's very important. It's not about in a lab when we plan experiments and we provide the services that we do our own research, we are always thinking about what the outcome would be rather than how much money it will take. Money is definitely a part to run a lab, but along with the money, we always have to think about how much we deliver and how much, like suppose we have committed something to the society, to the government or something, so we need to deliver that also. So cost is definitely a part, but multiple times you are anyway losing that part, and the amount of staff has to put into dispense, because what the practical problem what I could see if you are using a normal tips. Anyway, right now we are not using it. So you need to dispense multiple times, maybe half microliter is still left over in the tip. And then anyway, you have to pick up only one microliter, and you see maybe 100 nanometer or something is still left over. What you do is you do multiple times down, like to push up the piston and all, and you don't know whether you could deliver it or not. You just need to believe that you have delivered it, and that's the where this variation started coming in. And then you are not very confident about the data what you have it. If you are confident anyway that like my students are not confident and they will come to me, and then I'm not confident about what they are doing. So better to invest something little bit extra and then get something better rather than repeat everything multiple times. Time is the key here. So
Yeah, as they say, time is money. So yeah, it makes sense in that case. Dr. Dhruv, what are your thoughts on this? Obviously, with the healthcare and diagnostic setup, when we talk about the cost per test, basically, so we always talk about the recurring cost. So what is your take on this, sir?
I think, see, initially the cost of investment will be higher, I think so, for the whenever you, because it's a cost of quality which you are trying to put it into, and maybe like it depends, what type of staff you have. Like, if you are dealing with the inexperienced staff, probably at the initial point to go with, I think, then it will be a definitely a huge help, especially like you have some fresher joining into an institute and then you are trying to train them in the molecular lab, probably. For them, I think this is going to be helpful because it will help to reduce your kind of wastage of reagent or failed experiment and all that, probably that is going to help. And secondly, it will have your workforce efficiency, because what happens that sometimes, like staff get frustrated because some bizarre results come or some experiment fails, then they have to again repeat. So it's a waste of time, reagents, as well as the delay in the giving the reports to the patient. So I think overall, if you consider the cost is going to reduce, but if you say upfront cost, definitely they are going to be high. But I think now in India with a lot of innovation and lot of competitiveness, I think the cost part also we can take care. I think with the support of the Make in India and all those things is now happening in a big way. So I think a lot of innovation is happening in our country itself. So probably rates are also going to be competitive and it will help the society at large, I think so.
Yeah.
Uh,
True, sir. True, sir. I mean, yeah, this was very critical point basically, because we in this scenario we always talk about the recurring cost, but then quality and the repeatability, reproducibility, all these are the very crucial aspects which we also have to consider apart from cost when we are on to some experiment. Right. So yeah, it was a great insights basically by both of you, Dr. Nirpender Singh and Dr. Dhruv. With this, we end the panel discussion and we will now be open for the Q&A. So participants who have already sent their questions to us, we'll take them one by one and others can also write us on the box regarding the questions what we have. So I can see few questions here. So yeah, maybe Dr. Singh, if you would like to take this, someone writes, if my experiment results are inconsistent, could the type of pipette tip I'm using be part of the problem?
there could be several, but not only, yeah, pipette tip could be one, but along with that, your pipetting style also could be a one. Because it's, you should, yeah, I'm not denying that pipette tip is not playing any role, but your pipetting style and the kind of pipette what you are using, that also plays a very, very important role. So you will see in a lab, we will have a different kind of pipette. Some pipettes are very soft, very easy to handle. Some pipettes are a little bit hard. You will feel a jerk into it. So depending upon if you are having it, so you need to tune your hands accordingly how you want to pick up. So when we were doing a PhD and when we were getting training, so always it has been told to us that your dispensing and your pickup speed of the pipette has to be same. You cannot just say that you will pick up with very fast speed and dispense it very fast, very slow. So it has to be slowly. You need to pick up and slowly need to dispense so that you can whatsoever you have picked up, you need to dispense it. But now these days, very soft pipettes are there, so at least that is little bit to control. But if you are having those kind of pipettes where you can control these things, you need to first practice on those, how much you are picking up, how much you are dispensing, and definitely you look for the tip also and an amount of material what you are doing it, and always try to put reactions into a triplicate so that you always have a fallback mechanism to figure out what went wrong.
Yeah, there are several aspects to this. Yeah, very true. Dr. Dhruv, second question I would like to have it for you. Someone asked me, how can I tell if the pipette tips I use are low retention? Way to identify them.
I don't know, you have to purchase them separately, and when you are asking your vendor, you have to ask for this kind of tips. I think probably, or your store manager, you have to ask that you need this kind of special pipette tips. Probably then you can procure them. I think you can guide on this, that how they are different from the routinely used pipette tips. Generally, most of them they use a filtered tips. I think the low retention tips are having a different type of specialized material it is made up of, as well as a specialized, uh, you know, things are there. So with that, I think your store manager has to be have an idea, and you should know like how to ask the vendor for the special type of pipette.
Yeah, yeah. True that, true that. So there's one more question which is also on the lines on what Dr. just answered. So the participation, uh, yeah, there's some question which talks for someone working long hours in lab. What's one you would give about improved pipetting accuracy and avoiding sample loss? I think, Dr. Nirendra, you've covered that in the first question. Dr. Dhruv, you want to add something on this? Like, what is that one tip which you can give for improved pipetting accuracy and avoiding the sample loss?
I think, see, it depends on how much attention span you have, So you, like, initially when you come for the beginning of the day, your attention span is going to be higher. So do all critical activities at the beginning of the day, and when you are like tired and all, try to do little less engaging things, where you don't need. And see, putting and all is a kind of a very skilled job. It's like driving. Once you learn driving, you will always drive irrespective of your attention being there or not there, because then it becomes like a very instrumental kind of a work probably. So initial phases, yes, you have to be very attentive, because you know it requires some kind of training, like how sir mentioned that for 2 months they used to keep on doing the same thing probably. So here we allow 3 months time for them to get acquainted with doing the same and same. Because see, whenever you do repeatedly the same and same, it's a skillful job. So your skills has to develop. It doesn't develop overnight. You have to be little patient with those things. And I think do critical activities when your attention time is maximum probably. And I know it's a monotonous kind of work. So try to take little gaps, in between. Um for a while, or change of work is also kind of a rest only. Like you shift from this bench work to another bench work, probably that will be your stress buster in that case, probably. I think all these are the practical ways, you can jump and shuffle and kind of make it more productive and more engaging and more fruitful for I think your own benefit.
Yeah. True, sir. Well answered, sir. And the last question, I think this is the last question what I hear is we often talk about pipette calibration and technique. how much
Yes.
of accuracy actually depends on the tip itself? Dr. Singh would like to take this.
Can you please repeat this
Yeah,
question?
yeah. So it talks like, we usually talk about the pipette calibration technique, right? So how much of the accuracy actually depends on the micropipette tip itself?
Yeah, actually, pipettes are designed to uh, pipette and dispense the desired amount, but this has to be performed through tips. Okay, so what as we are discussing today, low retention tips means whatsoever you are picking up, and I think some other questions you asked, how to differentiate between a low retention tip and the normal tip. What my feeling and what I could see in the lab is low retention tip always when you pick up and then when you dispense, your tips are always very clean. It doesn't have any trace of solvents or the liquid attached to it. So most of the things get dispensed. So that means if you are doing a calibration and for a calibration you need a tip also which can pick up and dispense the required amount. And you know how this calibration is done normally in the lab. We used to do a calibration pipettes in the lab during our PhD time. So we used to weigh, suppose one ml pipette is there, we used to weigh 1 ml and then measure how much it is weighing, and then by the density we calculate and put it, okay, now this is the amount it is picking up, and then change the seal to see how much it is now picking up in that way. But it is all depends upon if we are using a wrong tip and 10 microliter is hold up in the tip, so that means we are getting a weight of 990 microliter of water rather than 1 ml of water. So that's the reason, along with a very high precision pipette, where you say that pipette accuracy is absolutely fine, but if your tip is holding it something in itself, then you will not get it, because pipette without tip it cannot pick up anything, because all the things will go into cylinder. So to calibrate a pipette, you need a very good quality tip also. So that's the reason you need a good quality
Yeah,
tip
yeah.
for.
That's true. That's true. I hope this all the questions are well answered in depth and with the experience what our panelists have throughout their careers. So as we approach to the conclusion of today's session, I'd like to extend a heartfelt thank you to Dr. Dhruv Mamtora and Dr. Nripender Singh for sharing your valuable expertise and insights with us. It has truly been a pleasure to have you here for this session.
Thank you. And we also learned a lot with this webinar and the question and sessions. Thank you. Yeah.
Yeah, thank you very much.
Yeah, I hope today's discussion has provided key takeover all the participants who have dedicated their time. Stay connected for more episodes of the Expert Exchange 2.0 webinar series by Acumex. Thank you.
Thank you.